Hello, everyone. Welcome to my YouTube channel. My name is Silvana. I am a certified functional nutrition counselor, and I like to talk about topics related to women's health. This week, we're going to talk about medical gaslighting. And I just want to clarify this is not about blaming anyone, it is purely about opening the door to a discussion. I do believe medical professionals have a very difficult job, but this is a topic that absolutely needs to be discussed. I'm going to start with a personal story and then we will move on. So, I do want to talk about my initial experience with medical gaslighting, and this happened years ago. It is one of many stories and experiences that I have, but it is the first one, so I'm choosing to share that story. Many years ago, when I was diagnosed with polycystic ovarian syndrome, I was placed on metformin, which is a typical drug used to help manage insulin and glucose levels for women with PCOS. Shortly after I began taking the medication, I experienced severe back pain. Severe back pain to the point to where I could not move from the couch. After a few days of taking this medication, I called my doctor and I explained to them that this is the only thing that I have changed and that I'm experiencing severe back pain. I was told that it could not at all in any way be metformin. It is not possible. It is not in the literature. It is not a listed symptom, so it could not be happening. After a few more days of this, I decided to lower the dose by taking away one pill. So, after doing that, I noticed that the pain decreased. I did this for a few more days. I continued to experience decreased pain. And after a few more days, I completely removed the medication and the pain disappeared. So, I guess I must be an outlier. This is my very first experience of many. But now let's look at what the literature says. So in this article here, 60 seconds on medical gaslighting. Patients can be vulnerable to having concerns dismissed or being gaslighted as to their legitimacy. Implicit biases against women in both clinical and administrative settings are known to foster conditions for unsafe care. This piece defines the use of the term gaslighting and how it can result in diagnostic delay due to lack of patient-centered communication and respect. Let's move on. Okay, let's take a peek at this article right here in the DC Journal. I'm just going to read the very top of it for you. The rest of it is available for you to read through. It happened to Serena Williams. It's recently happened to my friend Stephanie Rivera, the CEO of Lazarex Cancer Foundation. It's also happened to me. It's medical gaslighting, dismissing, downplaying, or not believing patients when they share their symptoms in a healthcare setting. This is a far more common experience for women than men. So, in a nutshell, let's keep going. Okay, now let's take a look at some statistics. 17% of women say they have been ignored, dismissed, or felt like they had to prove their symptoms to their doctors. 25% to 37% of patients of color were less likely to receive appropriate treatment for blood clots, suggesting even greater effects of medical gaslighting for women of color. When it comes to cancer care, women are twice as likely as men to report symptoms 5 or more times before they're diagnosed. Heart disease is the leading cause of death for women in the United States and can affect any age, but doctors continue to dismiss it in women, leading to late diagnoses or preventable deaths. Women's symptoms are often attributed to stress, hormones, or depression. And it takes on average 10 years for women to be diagnosed with endometriosis because doctors don't recognize the condition or know how to treat it. Now, go back to my video about the history of healthcare and the fact that women have been excluded from clinical research. Let's move on. Okay, now let's take a look at some examples. Patients often describe the numerous unhelpful messages received in the past regarding conditions such as IBS, including "it's all in your head," "it's just stress," "you're doing this to yourself." These statements are commonly experienced as medical gaslighting due to the significant impact of the gut brain axis on the GI functioning. Many symptoms or conditions may be exacerbated by stress. And in all honesty, this is really an area where functional nutrition shines. But let's move on. Now, let's take a peek and see what the American Medical Association recommends that we do to prevent medical gaslighting. Because medical gaslighting and invalidation can involve numerous factors involving the provider, patient, and medical system, and broader culture, there may be no way to completely prevent the experience entirely. There are several strategies that they recommend, but I'm only going to read one. Believing the patient. Providers can reduce the risk of medical invalidation by communicating they believe the patient's subjective experience of their symptoms. And I'm going to stop here and I'm going to talk about the fact that it is not possible to include the entire world population in studies. We are all genetically different. It is not possible to assume that a medication or a supplement or a symptom is going to present exactly the same in every single individual in this world. So that's where I'd like to start. Now, I have a few more suggestions to make on how we can reduce medical gaslighting in, in the healthcare system and how we can close the gaps to make this a much better functioning system. This is just, in my opinion, an observation, but I think I have some pretty good points. So let's keep going. In closing, I am going to talk about functional nutrition and how it can bridge the gap in a clinical setting and potentially even help reduce medical gaslighting. I'll talk about that in the end, but first let's take a look and see what the Institute of Functional Medicine has to say about nutrition. Nutritional imbalances are potential contributors or causes of several chronic conditions, and nutrition-based interventions may bring relief or potentially resolve these conditions completely. Proper nutrition is associated with not only disease prevention, but surgical recovery as well. Going down a couple of paragraphs, when high quality nutrition is applied effectively and consistently, it may prevent future chronic disease in adolescents, enhance conditions in people with dementia, and improve outcomes in patients receiving colorectal and GI oncological surgeries, to name a few. Moreover, in patients who have hospital stays for any reason, nutrition support is associated with fewer infectious complications and shorter length of stay. Chronic diseases account for the majority of health concerns in middle-aged and older populations, and many of these conditions respond well to nutritional interventions. Risk of obesity, diabetes, hypertension, and cardiovascular disease are strongly linked to lifestyle, especially dietary choices. Okay, so in the end, it is my job to take time and to really get to know a client's personal story, in addition to make recommendations that are going to be lifestyle interventions, nutritional, and other lifestyle recommendations. It's my job to dig deeply to help that client to figure out why they have reached the current state that they have reached. I know that doctors and nurses don't have the time to do this deep dive that I, as a functional nutritionist, have the time to do. And if we allow functional nutritionists in clinical settings, wouldn't it make things a bit easier, especially when it comes to chronic disease prevention and treatment of chronic diseases, in particularly where lifestyle modifications and nutritional recommendations are concerned? It's not about us or them. It's about both of us creating an actual team that a client or patient can feel more supported by. Somebody who could potentially communicate with aspects of that person or the client's care that could potentially make a difference in the overall care that they will receive from a physician. It's again not us or them. I think it's really both of us because ultimately clients and patients deserve much better. Hopefully, this made sense to you all, and feel free to comment below if you have any questions or any criticisms or anything that you'd like to add to this conversation. Next week, I'll be talking about a topic that is not going to be very comfortable for a lot of you, but I feel like it's a topic that needs to be covered. Have a fantastic day, and I will chat with you later.